Hi, this is Inside Cardiology, and today we're talking about a hot topic, vaccination. Vaccination, by tradition, was a topic for infectious disease physicians. But no, it's also very important for cardiologists, as we learned during the COVID pandemic. Now, if you look at this figure here, you can see we have different viruses. Influenza virus, SARS-CoV-2, RSV virus. We have also certain bacteria. They all cause infection and inflammation. As you see on the right panel, the NLRP3 interleukin pathway, which is the innate immunity, is activated whenever we are hit by one of these agents. And it induces, of course, interleukins, interleukin 1 beta, interleukin 6 and others. And eventually we measure CRP, which is just a marker reflecting the activation of interleukins. So this has consequences in the cardiovascular system that's often overlooked. And so if we look at the next figure here, this is basically atherosclerosis in a lifetime in a nutshell. You get a plaque, you have macrophages, T cells, cytokines, proteases, NLRP3, inflammasome, shear stress, some inflammation burst, and you have a plaque rupture, and eventually you have an occlusion, you have a STEMI, a myocardial infarction, or a heart attack. And then, of course, the question is vaccination good in this context? So basically, the question is, if you're vaccinated, you may still get a little bit of influenza, but is it protective in terms of not inducing any acute myocardial infarction, as I have shown you in a minute? Now, when we look now at this figure, this is influenza vaccination after myocardial infarction. This is a trial in 2,571 subjects, and it's either vaccination or placebo. And you can see the primary outcome, all major adverse cardiovascular event, minus 27% in those vaccinated. All-cause deaths, minus 41%. Cardiovascular deaths also highly significant, while acute myocardial infarction was not. So clearly, in this paper published in Circulation in 2021, we got the evidence also by numerous other trials that if you are vaccinated and you catch influenza, you are protected in terms of cardiovascular events. And this is even more so here. This is total hospitalizations. You can see vaccination, vaccination-free, and you can see cardiovascular events after the hospitalization from day 31 to 60 up to a year. And you can see the effect, the protective effect is massive. It fades away over the year, and after 1 year, it is lost. But overall, it's a 24% relative risk reduction when you look at the hazard ratio here with the diamond symbol. And then, of course, there is not just influenza, there's also COVID, but there's also RSV. That's a virus that is more in center stage lately. And here is the very same thing. You get an RSV infection, you get pro-inflammatory cytokines, be it interleukin 6, 1 beta or TNF alpha. You get a hypercoagulatable state, plaque destabilization, and cardiac disease. And of course, the older you are, the higher the risk. And then, of course, cardiac disease, again, in another feedback mechanism, will increase the risk of RSV infection. And, of course, many others, including pneumonia. And therefore, it is important to consider vaccination against COVID, influenza, RSV, and pneumonia, and maybe in the future also other agents. Now, what is the risk of vaccination? And during COVID, this was a very hot topic, and a lot of conspiracy theories were presented. And here you can see the cases of myocarditis in 1 million subjects. So in 1 million subjects, we have about 1,400 patients with myocarditis in COVID-19. So this is when you have the virus infection, there is a myocarditis risk. If you have the COVID-19 vaccine, then of course it's much lower. The same applies for smallpox and other vaccinations. So clearly there is a minimal risk of a myocarditis if you get vaccinated, for instance for COVID-19, but it's massively lower compared to when you have the infection without vaccination. So we do actually have a call for action from the ESC, and we would say vaccinate during index hospitalization in patients that are hospitalized for an acute coronary syndrome or heart failure. Use an interdisciplinary heart failure network to make sure that all heart failure patients are vaccinated, and inform patients and the publics. It's not just that you want to prevent an infection, you want to prevent also cardiovascular problems such as infarction, stroke, and premature death. So when we look at the pillars of cardiovascular prevention, we can say we have hypertension, we have lipids, we have diabetes, but we have now also infections or vaccination as a strategy to reduce any cardiac complications after any infection, be it RSV, COVID, or influenza, and also pneumococcal infection. For all of those, you can have a vaccination, and it's good for you. And if you want to know all the details, this is the SC consensus paper published in the European Heart Journal, Vaccination as a New Form of Cardiovascular Prevention. And read it as well, because it's important, and tell it to your friends and your patients. Vaccination is more than just preventing infection. It is cardiovascular prevention. Thank you.